Medicines have become part of the everyday management of health in Australia, and especially in the management of chronic conditions. Despite a higher burden of disease, the PBS spent per capita for Aboriginal and Torres Strait Islander people is 60 cents for every $1 spent on PBS medicines for the general population. Access to medicines and quality use of medicines are critically important to the ongoing health of your clients. Pharmacists are a well-respected resource for medicine support and information in the Australian healthcare setting. ACCHOs provide comprehensive care, and there is a place for pharmacists to work in ACCHOs so that they can respond to the individual needs of the patients and staff. Keep our mob healthy. Let's hear some stories about ACCHOs who have used pharmacists to help.
One big thing that we do is medication reviews. I think it's very beneficial for the GPs and the client that the GPs know the pharmacist who's doing the review, and we have ready access to the GPs to discuss the reviews. Also good for the clients because they know me, or they know the pharmacist who's here, and they're more readily happy to discuss their medicines.
And having people like yourself come around and talk to us in our home setting, it makes us feel more comfortable. Whereas when you go to the doctor, to the hospital or to the clinic, it's like it's more rushy and you're not getting all the information that you really need. And that's why we really appreciate you coming around and talking to us in our own area, in our own place, and explaining those tablets to us.
We've been able to then utilise that information that their pharmacist has not only extracted and collated with the health worker about that patient and about that specific issue, but then all of their knowledge about the medications with that deep primary care context as well. They can then give us advice that's really rich, it's powerful, it's evidence-based, it's independent, and these are all things that provide us with a great sense of trust in that service.
Another one of the patient support activities I do is supporting with transitional care. So when patients go from community into the nursing home or from hospital back into the community, I help make sure that they're on the right medication, that they can get scripts and start them on Webster packs if they need to.
Transitioning between healthcare settings is, again, one of the biggest impacts we can have as pharmacists. An example that I remember was a fellow, he had a quite serious cardiac admission. So he had no idea what was what. They were different brands of medicines, so they looked different to him, and was just all a bit confused about what he was sort of take, because he did have a Webster pack in the past. I was able to go to his community pharmacy and talk to his community pharmacy straight away. We were able to get a Webster pack sorted after I reconciled his medicines by looking at the discharge summary, our current list, and what the pharmacy had to make sure we had an accurate and correct list for him.
It's great to help people improve their own health literacy and to help empower patients. So we have a lot of different resources at our fingertips that we can help share that knowledge with our patients for them to then be able to access that.
So as a practice pharmacist at Wathaurong, I'm a one-stop shop for medicines information. So if any of the staff have any queries about medications, interactions, new medications, I'm the person they come to. I also provide updates regularly via email or during the meetings about any new things, so new criteria in the PBS or anything like that.
It's so good to have a pharmacist here regularly to discuss things with, for them to review my chronic disease patients, because they need really more time than they actually get in these remote places. So yeah, I sort of really appreciate having a pharmacist involved, and hands-on is so much better.
As part of my role, I'm part of the Clinical Governance Committee. So we meet every couple of weeks and we talk about all issues with the health service, and I, obviously being the pharmacist, I particularly comment on all the medication and quality use of medicine. As part of improving quality use of medicine, I've done a drug use evaluation. So one of the ones that I've done has been around on patients who are using high dose opioids or opioids with other medications that are CNS depressant, like benzodiazepines, and seeing whether they've been prescribed naloxone, and then if not, creating a list and providing that to the GPs around having a discussion with those patients about naloxone. And then once they've been prescribed it, I actually provide the training for the naloxone for the family and the patient. Some of the ways I've been able to help people with adherence is mainly around Webster packs, so organising a Webster pack for them. Also looking at alternatives to medications that might cost less, sometimes even getting their medications delivered.
NACCHO was proud to be associated with the IPAC program, where the value of the pharmacist integrated into an ACCHO was demonstrated. The comments on the report to government stated that the model of care examined in the IPAC project was an excellent example of an integrated, collaborative, patient-centred approach to primary care and has the potential to have a meaningful societal impact by improving equity of health outcomes for Aboriginal and Torres Strait Islander peoples. The NACCHO Medicines team will assist your ACCHO and any pharmacist you engage with the development of the role. The first step in recruiting a pharmacist to your ACCHO is to identify what activities related to medicines your ACCHO needs. Talk to clinical staff, patients and pharmacists that may already provide some pharmacy services to your ACCHO to get an idea of what role a pharmacist can play. NACCHO has developed a tool to assist with this, to help understand the scope of practice of an integrated pharmacist and to help define the role in improving the health of your patients. Defining roles may depend on the funds available to support a pharmacist as well as specific needs of the ACCHO. Pharmacists can deliver culturally safe care when working in an ACCHO's, and additional education is available through the Deadly Pharmacist Foundation training course developed by NACCHO and the Pharmaceutical Society of Australia. Pharmacists have identified a role in an ACCHO as a rewarding one and are eager to participate. It may be that a pharmacist can be shared with other ACCHOs in the area, aged care facilities or with the local community pharmacy.
Through those years, my work type with them and the sorts of things that I am able to bring to the role have changed quite significantly, which makes it really interesting and continually rewarding over many years.
A pharmacist can help improve safety and quality of use of medicines, as well as ensure affordable access to medicines in your ACCHO.
You don't realise what you're missing until you've had a chance to taste it, I think, and that for us is having a pharmacist embedded has really changed the way we work. I think it's improved our safety, it's improved us in other areas such as our CQI activities. It gives us the ability to look at it from that angle as well as from a general CQI view. And I think the patients, most importantly, the patients report back that they find that it's not only acceptable, but they enjoy their time with the pharmacist. They actually learn a lot, and they're coming along a journey with their health, and hopefully in time we'll start to see those benefits.
It's good that we had to talk, and now I know why I'm taking them.